Hello, my name's Amanda. I'm a staff nurse in North Devon. About 20 years ago, I realised that I could actually train and do mental health nursing, so I jumped at the chance and that's how I went into it. My first job when I qualified was on Ocean View as a staff nurse, and then I went over to the older adults ward just to get a bit more experience, and then decided I'd come back into the younger adult setting, and I think about 5 years I've been on Moreland View now. I'm really proud of the job I do. I love it when we see people on the journey to recovery. It's just so fulfilling, really. You see it start to happen here in hospital, and then we often hear back from patients that have fully recovered. It's just a joyful part of the job. When they are on their way home and you get some really good thank you cards that are not just thanking you for just bog standard thank you, but actually going into detail about what we actually did for them and why it made a difference to their lives. There are times when the ward is distressing to be. Things happen, it is an acute mental health ward, but we have really good supervision, and that is a really big bonus for us. You can go into supervision and talk to someone who really understands what it's like on the ward. I'm from a big city, so I came to North Devon about 30 years ago, and just living here in this beautiful surrounding, I do a lot of walking on the beaches and the countryside. I have a walk along the Ilfracombe Harbour. It is one of the best harbours, I think, in the southwest. It's as beautiful as Padstow. It's a working harbour, so there's always things going on down there, but it's stunning to go down there and just sit and watch the sunset or watch the sunrise. Yeah, it's beautiful. I've got 4 sons that have all had a little go at surfing. One of them's a fisherman, so he goes out regularly on the fishing boats. I didn't want my 4 boys to be brought up in a big city, really. That was my main reason for coming here, and that's why we did come here to live. We're very lucky. I think DPT is quite a big organisation, but we're quite a close team. The life balance between work and leisure, the opportunities are countless, really. I do lots of things outdoors, and I think anybody to come here to live is just a bonus to work here and to be able to live here as well. We're very well looked after as staff. We're encouraged to make sure we take our annual leave. We have team meetings where we're encouraged to discuss anything and just generally look after ourselves, really. One of the other good things about DPT is that they encourage us to carry on learning, not just things that obviously are essential learning, but to actually encourage us to do things that we'd like to do as part of carrying on, really. I want to carry on learning right till I retire, and they encourage it very much so.